Welcome to the deep dive.
Glad to be here.
Today we're plunging into a topic that's, well, it's really at the crossroads of a lot of things. Healthcare, ethics, law, global economics, medical tourism.
hmm
We're looking at insights from discussions with Professor Glenn Cohen from Harvard Law. He wrote Patients with Passports, and Dr. Robert Klinsman, who's a professor of psychiatry and bioethics at Columbia.
Some heavy hitters in the field.
Definitely. Our mission today, to kind of cut through the complexity, really unpack the biggest problems and, the toughest ethical questions around this whole phenomenon. It's growing so fast globally.
It really is.
Right. Let's dive in.
Okay. It's a complex landscape, as you said. And the sources show, I think, a good way to start is just sorting into two main buckets.
Okay.
On one hand, you've got people traveling for procedures that are perfectly legal where they live. Think hip replacements, maybe cardiac bypass, cosmetic surgery, that kind of thing.
Standard stuff, just done elsewhere.
Exactly. But then there's the other side, which is often, well, ethically much more challenging. That's when someone travels specifically for something that is illegal back home.
Ah, right.
So that covers things like assisted suicide in some places, abortion, certain experimental stem cell therapies.
Got it. Okay, let's tackle that first bucket then, the legal procedures. You might think, okay, it's legal, what's the big deal? But the sources suggest, even here, there can be pretty significant problems for the traveler.
Oh, absolutely. A major one is just quality control. It's incredibly hard to really assess the quality of care you'll get abroad.
How do you even check that?
Well, that's the thing. It's tough. The sources do mention, yes, some centers are fantastic, truly world-class, maybe like a Mayo Clinic. But there's a huge range. And many places are, well, much less reliable.
Yeah.
You're taking a bit of a leap of faith on the quality front.
And if that leap doesn't quite work out, if something goes wrong?
That's problem number two. Your legal options, trying to sue for malpractice or get compensation, often very, very poor. Yeah, you're trying to navigate a foreign legal system. It's complex, often stacked against an outsider. It's a real barrier.
And presumably you need care after the surgery too, recovery, checkups.
Exactly. Follow-up care is crucial for most things. But do your medical records get sent back home properly?
Good question.
Can your doctor here even make sense of them to manage your ongoing care? Often, that information transfer is clunky or incomplete or it just doesn't happen effectively.
Okay, so risks for the individual. But you mentioned something else, the impact on the destination countries. This is where it gets really interesting, maybe.
Yeah, this is the systemic angle, and it's a big one. It's not just about the individual traveler anymore.
Right.
Think about it. When you have lots of, say, relatively wealthy patients from the U.S. or Europe going to places like Thailand or India for treatment, what does that do to the healthcare system there?
I see where you're going.
Does it create this pull? Does it devote resources, skilled doctors, nurses, equipment, investment away from the public hospitals, away from the needs of the local population?
Towards building up this private industry catering to foreigners.
Precisely. It raises these really significant questions about equity and resource allocation within those destination countries.
Wow. Okay, so even the simple case of legal medical tourism isn't so simple. It's got individual risks and these broader global impacts.
Definitely.
But as you said, there's that whole other category, traveling for things that are actually illegal back home. And this is where the ethical waters get, well, really muddy.
They really do. These cases force some very tough questions societies maybe haven't fully figured out yet.
Like abortion tourism. Abortion laws are, wildly different across the globe. In many places, it's illegal or so restricted it's basically inaccessible, which leaves women in desperate situations.
Right. And the source material talks about Ireland's past situation, the travel amendment idea. Abortion was illegal in Ireland, but the law essentially permitted, or at least didn't prosecute, women traveling abroad, usually to England or the Netherlands, to get one. It was a kind of informal compromise, a modus vivendi.
A way to sort of split the difference?
Sort of. But critically, travel isn't cheap or easy. So this option was really only available for those who could afford it.
And that brings up a really uncomfortable question for the country with the strict laws, doesn't it? Yeah. If a country bans abortion based on, say, deeply held beliefs about fetal personhood.
Right.
Does it make sense, logically, from their own perspective, to just let citizens pop over the border and do the very thing they forbid?
It definitely challenges the consistency of that stance. I mean, if the act itself is the moral issue, why should geography change that?
Yeah.
The sources draw parallels here to other laws countries have that apply outside their borders, extraterritorial laws.
Yeah.
Like the U.S. criminalizing its citizens engaging in sex tourism abroad.
Okay.
Or the U.K. making it illegal for citizens to take their daughters overseas for FGM, female genital cutting. Many people find those intuitive. We think those acts are wrong, period, regardless of location.
Right, that makes sense.
So the question raised is, should a country that views abortion as morally wrong treat travel for it in a similar way?
But the flip side, that safety valve idea, for someone in a truly terrible situation, maybe a rape victim in a country with zero exceptions, isn't some option abroad better than none? Shouldn't they be allowed that out?
That's the powerful argument, focusing on individual liberty, maybe even necessity. But the sources introduce a really critical point here, the distributional consequence.
Meaning?
Meaning, because travel for medical care is almost always easier for wealthier people. Doesn't this safety valve primarily benefit the elite?
So if the influential people can just leave to get an abortion,
Does that reduce their incentive to fight for legal changes or better access for everyone within their own country?
interesting point.
Yeah, the source uses a lottery analogy. Would it actually be fairer, maybe, to have some kind of limited, perhaps random access domestically for extreme cases, rather than what amounts to unlimited access only for those rich enough to travel?
It really forces you to think about access and fairness, doesn't it? Who benefits from this setup?
Exactly.
Okay, shifting gears a bit, but still in this ethically tricky zone, organ tourism. We all know waiting lists for organs, especially kidneys, are incredibly long in places like the U.S. So the seemingly simple answer might be, why not just go somewhere like the Philippines or Pakistan and, well, buy one?
It looks like a straightforward supply and demand fix on the surface, but the reality is much more complex and ethically fraught.
How so? For the buyers first.
Well, for the buyers, the data on how well they actually do rejection rates, long-term survival compared to getting a legal organ at home, it's often conflicting. There are big gaps in what we know.
So it's not necessarily a guaranteed better outcome.
Not at all. We don't have really solid evidence that it works out better, or even as well, for the recipient in the long run.
But the ethical arguments against buying organs seem much clearer.
They generally are. The sources list several key ones. There's often corruption involved in the whole process. There's the whole idea of commodifying the body, putting a price tag on human organs, which many find deeply problematic.
Devaluing human life, essentially.
That's the concern. And then there's the huge potential for coercion and exploitation of the sellers. Even if someone isn't explicitly forced, the extreme poverty driving the decision often makes it inherently exploitative.
Right.
And one really strong argument highlighted is this idea of, well, justified paternalism.
Meaning protecting people from themselves even if they consent?
Sort of. The view is that even if the seller isn't technically coerced, the act of selling an organ rarely benefits them long term and often causes significant harm, physical, social, economic. So intervening might be ethically justified. This is seen as perhaps the strongest case against it.
And what do we know about the sellers themselves? What are their stories like?
Pretty grim, unfortunately. Reports from places like Bangladesh, Pakistan, the Philippines, India, they show a consistent pattern. Sellers get paid relatively little, maybe $2,000 to $5,000.
Wow, that's it.
Often, yeah. And frequently, they don't even get the full amount promised, maybe only 2/3.
And why do they do it?
Desperation, usually. Trying to escape crushing debt, bonded labor, needing money for a daughter's dowry, hoping to start a tiny business like a market stall. Really fundamental needs.
And what happens to them afterwards? Does it solve their problems?
Sadly, often not. The outcomes are bleak. Regret rates are sky high, like 60–70% wish they hadn't done it.
That's awful.
Yeah. They often face major social stigma, being called kidney man or something similar, which can hurt marriage prospects, community standing, their original financial goals. Often not achieved. They're still poor, still in debt. And the physical toll is stark. 2 huge scars, maybe 20 inches, compared to a tiny 3-inch scar for a donor in a top hospital. Pain, long-term health issues.
It sounds like trying to regulate this kind of trade globally would be almost impossible.
Pretty much is. Selling kidneys is illegal everywhere except Iran. And even Iran has a very specific system you sell to the government, which then allocates the organ. It's not an open market. So when you have a market that's already operating entirely underground, across borders, it's incredibly difficult for any one country or even international bodies to effectively control or police it.
Okay, let's turn to another area where laws differ wildly. assisted reproductive technologies, or RT.
Right.
The sources point out a big contrast between the U.S. and many European countries here. The U.S. allows commercial transactions, buying, selling eggs, embryos, commercial surrogacy. Europe often restricts payments to just basic expenses.
Yeah, and that difference creates a huge flow of people seeking services. You see it within Europe, like French couples going to Belgium for things unavailable at home. And you definitely see people traveling to places like the U.S. or historically to places like India, often driven by lower costs or different regulations.
So back to that core question.
Yeah.
For a country like France that prohibits commercial surrogacy, is it hypocritical, or at least inconsistent, to let its citizens just go abroad and do it?
It forces them to confront why they prohibit it in the first place. Is it about the child's welfare? Well, that concern shouldn't really change based on geography.
Right.
Is it about protecting the surrogate from exploitation? Okay, but does France really have the standing or the ability to protect surrogates in, say, India or California?
And doesn't banning it at home maybe just push the demand elsewhere?
That's a really interesting point raised in the sources, the potential unintended consequence. By prohibiting it domestically, you might actually be creating the market conditions abroad, possibly in places with even fewer protections for surrogates.
So could France, for example, try to make it illegal for its citizens to pursue commercial surrogacy abroad, like an extraterritorial law?
Some countries do try similar things. Turkey apparently has laws against citizens getting artificial insemination abroad. But the expert view presented in our sources is that commercial surrogacy is a particularly difficult case for this kind of extraterritorial reach.
Why more difficult?
Especially if the main argument is about protecting foreign women. It just feels ethically and legally more complex than applying extraterritorial laws to something like abortion or assisted suicide, where the focus might be more on the act itself based on domestic values.
And then there's a massive practical problem. What happens when the parents do use surrogacy abroad and bring the child back home?
Exactly. That's the huge challenge. Recognition of parentage. Citizenship.
How does that work?
Laws vary dramatically. Some countries base citizenship on bloodline jus sanguinis, others on place of birth jus ali. So take that French couple who goes to California for surrogacy. Should the California doctors refuse care because of French law? The expert view says probably not.
Okay, but should France refuse to recognize the child as French, or refuse to recognize the intended parents as the legal parents, maybe as a deterrent?
That's the agonizing dilemma, isn't it? Refusing recognition seems incredibly harsh. You're essentially punishing the child for the parent's actions.
Yeah, that feels wrong.
But if you do recognize the child easily, it completely undermines the deterrent effect of your domestic ban on surrogacy. People know they can just go abroad, come back, and it'll likely be okay.
So what do countries do?
They handle it very differently. But the tendency often is to lean towards recognizing the child's status eventually, maybe after some legal hurdles, which, again, makes enforcing that domestic prohibition beyond your borders really, really hard.
Okay, one last category mention. Traveling for experimental therapies. This feels a bit different from seeking an established procedure, even if it's illegal at home.
It is different, and the sources make a really important distinction here.
Which is?
On one side, you have genuinely experimental therapies, things that might have real scientific potential, but they're just not proven yet, not widely available. Mitochondrial transfer was mentioned briefly as that kind of complex, cutting-edge research.
Okay, high-tech, maybe promising, but still research.
Right, but then, much more common in the medical tourism sphere, you have therapies that are, well, basically unproven, sometimes outright harmful. Think about many of the stem cell clinics, particularly some in China historically. Often there's no solid scientific reason to think the therapy will work. It might even cause harm, like tumors. There's no rigorous data collection. It often amounts to selling hope or maybe snake oil to very desperate people.
And it must be especially tough when parents take children for these therapies.
Oh, absolutely heartbreaking, because kids can't consent. The expert perspective shared suggests there might be a stronger case for more restriction or at least mandatory reporting in those pediatric cases just because of that vulnerability.
But for adults, especially adults facing terminal illness.
For adults, particularly those with terminal or really life-threatening conditions, even if the science looks shaky, the desire to try anything is completely understandable. The sources bring up historical examples, like Laetrile back in the 70s, that unproven cancer treatment people like Steve McQueen famously sought in Mexico. The expert view tends to be that For adults in those desperate terminal situations, the state probably shouldn't heavily restrict their ability to travel and try something, even if it's likely futile or potentially harmful. It's a tough line to draw.
This whole conversation, it feels like it plugs into bigger debates about healthcare systems in general, doesn't it?
It absolutely does. Medical tourism sometimes gets used as a kind of weapon in arguments against universal healthcare systems.
How so?
Well, people will point to examples of individuals traveling from countries like Canada or the UK to the US, for instance, and they'll say, see, their public systems are failing. People have to leave to get faster care or higher tech care.
And one of the experts actually shared a personal story, right? About their Canadian mother coming to the US.
Yes, exactly, for a hip replacement. And the reasons given were wanting a shorter recovery time and, quite candidly, to Q-jump the waiting list she faced back home in Canada.
So from her perspective, the US looked better.
From an individual patient's point of view, especially for something elective but important like a hip replacement, yeah, getting it done quickly in a system known for high-tech options like the US can seem very attractive.
But there's a bigger picture.
Right. The source conversation contrasts that individual experience with the population-level view. Systems like Canada's or Germany's, even with wait lists for some things, often achieve better overall health outcomes for their population, or they pay far, far less per quality-adjusted life year gained than the U.S. system does.
So the individual story doesn't tell the whole story about the system.
Exactly. What's best for one person needing one procedure might not reflect what's best or most efficient for the population as a whole.
And this international aspect, it also brings up questions about the responsibility of the whole global community, doesn't it? When one country has laws that many others see as deeply immoral, like very harsh anti-abortion laws, for example.
It really pushes us to think about where national sovereignty ends and international concern begins. The discussion touches on this idea of zones of discretion, things countries get to decide for themselves, versus fundamental human rights, which are seen as non-discretionary.
So what can the international community even do?
Well, the tools tend to be softer. Things like pressure through international organizations, maybe sanctions in really extreme cases, sometimes invoking international criminal law. It's usually not direct intervention in domestic laws.
But it still leads back to that hard question. When does medical tourism cross a line? When does it become a human rights issue that demands some kind of international response?
Right. And brings us back to that really difficult comparison we talked about earlier. Is there a fundamental structural similarity between a country wanting to ban its citizens from traveling for an abortion and banning them from traveling for FGM?
It's uncomfortable to even put them side by side.
It is. But that's the core challenging question that the source material, especially Professor Cohen's work, really forces us to grapple with. It moves beyond just the domestic ethics of a procedure to ask, what are the international implications of domestic laws? How far should or can a country's prohibitions realistically extend when its citizens cross borders?
Wow. That truly was a deep dive. I mean, this isn't just about finding cheaper healthcare, is it?
Not at all.
Medical tourism forces us to confront these huge, complex questions. Quality, safety, legal rights, sure, but also resource distribution globally. Fundamental ethical beliefs about life, the body, autonomy.
It really throws that tension between individual choice and state control into sharp relief, especially when choices cross borders and bump up against totally different laws, different values, different economic realities.
Yeah, what's so fascinating is how these deeply personal medical decisions get tangled up in international law, in bioethics, in a society's core values. They're not just individual stories, they're part of this much bigger global picture.
Absolutely.
Yeah.
It makes you look past the surface convenience or the individual desperation and consider these much deeper systemic and ethical ripples.
So, wrapping this up, what does all this mean for you, the listener? Here's maybe a provocative thought to leave you with. Considering all these complexities we've discussed, the potential for exploitation, the impact on healthcare systems in destination countries, the clash of national laws and values, who really bears the moral responsibility here? Who's primarily responsible for making sure medical tourism happens ethically? Is it the individual traveler doing their research, the clinics advertising services, the country hosting the clinics, the home country whose citizens are leaving? Or does the international community have a role?
And maybe the toughest part, given how incredibly hard it is to enforce any kind of rules across borders, can truly ethical global medical tourism even exist? Or is it always going to be defined by these difficult, challenging gray areas?
Something to definitely ponder as you go about your day.